Now, President Bola Tinubu says his government is committed to achieving healthcare for all. His plans for the healthcare sector in 2024 are to revamp physical infrastructure and retrain healthcare workers exiting the country in droves. Now, joining me in the studio is Minister of State for Health and Social Welfare, Dr. Tunji Alausa. Good to see you and thanks for your time. The good thing, at least you're here. Thanks to all those that are still here that haven't left us. But again, before we get there, let's talk about the plans that the president is talking about. There were glory days in Nigeria to the extent that a lot of people from outside, from Asia and other parts of the world, came to Nigeria on medical tourism. How can we truly reverse or change the dynamics?
Thank you, Suleiman, for having me. Let me just echo what the president said yesterday. Healthcare is back on the front burner. We have to commend and thank the president, President Bola Tinubu, for his determination, his dedication to refocusing our country healthcare system. He's been very deliberate and very, when he makes all his comment about healthcare. So he's determined to fix the healthcare system in Nigeria towards not just now, but to put it on a path of sustainability, decades to come, where every single citizen of this country will be entitled and eligible to meaningful and comprehensive healthcare. Now, let me address the issue you've just raised about where our health system was in terms of manpower decades ago. Nigerians are very talented people. We're blessed in this country with talent, with manpower. And we have a very good educational system that the system is trained tens of thousands of Nigerians. That's why the developed nations were well sought after. But now what we've seen now is that there's so many people moving out of the country. We have some form of crisis in our human resource for health, our healthcare workforce. But then we have a population of 220 million people. We're not leveraging that population. We should leverage that population. It's a huge advantage. How many countries in the world have that kind of a population? So what we've done as a government since we've gotten in is that, listen, okay, we have people moving out. We shouldn't be in this situation where we have this shortage. So what we've done in the interim, since we've taken over, with the mandate and support of the President Bola Tinubu, is to increase production. We've begun to leverage our population. So the first thing we're doing now, we're increasing production of our human resource for health. Production in everywhere. You can actually imagine. With this academic section, we've doubled the number of students being enrolled into medical school and all allied specialties in medicine. So we've moved from 5,000 to 10,000 students. Now they'll be starting medicine and dentistry. The same thing in pharmacy. We've doubled enrollment. We've doubled enrollment in nursing, and I'll tell you something about nursing in a minute, give you clear data on that. We've doubled enrollment in medical laboratory sciences and every aspect of medicine. Yeah. That's the first thing. From just January of this year, we're enrolling just about 28,000 nurses in all our nursing schools across the country. In the last 3 months since President Bola Tinubu, or 4 months or so, has taken over, we in the Ministry of Health, we've quickly worked to rejig the entire nursing education system. We've added 26,000 more enrollees into nursing school.
That's a big figure. I hope you don't lose your train of thought, and I'll still come back so that you tell me the good news about nursing. But the thing here is how to ensure that these numbers, at the end of the day, they give back to the country, not forcefully. You must create an enabling environment. I recall quickly here in the early 80s, I'm quite sure it's your field, some of your professors and teachers back then left for Kuwait and Saudi Arabia. Guess what? They came back. So how can we make some people come back this is also tied to some other sectors of our national life, security, power.
Yeah, we'll make them, they will come back. And this is why they will come back. I told you there are two broad approaches that we're going here. Number one, we need to stop the bleeding, quickly produce more to cover that. Then number two, what do? We're investing in our healthcare system, strengthening our healthcare system, investing in infrastructures, equipment. We're rebuilding our hospitals. Now we're providing more conducive environment. This will take a few months, few months to several months before this investment start materializing. We're putting new equipment in our hospitals. Now, once we've created this enabling environment, you heard the president said yesterday, we're improving the welfare packages of our healthcare workers. So once we've created all this, guess what? Nigeria did it will be reversed inflow of healthcare professionals back into our country.
And quickly, I'll let you close on the nurses. How can we politically ensure that leaders like yourself and others also make use of our facilities? I recall growing up, even though he was a pathologist of blessed memory, the old Bendel State, I saw Professor Ambrose Ali at the University of Benin Teaching Hospital. So it could excite us that that's the man who is the governor, and he was right there. So how can we make politicians, leaders, to start using the facilities? Perhaps that can also help ensure that we get the best.
Thank you, Suleiman. This is extremely good. You've actually led me to a very good thought. Thank you. You're kind to me. Now, I refer to our President Bola Ahmed Tinubu as motivator in chief. He's really driving us to perform, to do the best, to give the best to this country. We've actually started that. I won't name for confidentiality. One top government official who serves in the cabinet was ill. I said, no, charity begins at home. They were planning to take her abroad. I said, no, you can't take her abroad. She went to Jabi, Federal Medical Center in Jabi. I said, this is upon my integrity. She will be treated at this hospital. She got treated. Every single level of care she got there was what you get anywhere in the world. I visited her almost every day, name it. CT scan, she was getting dialysis, she was this. There was one evening I went with some of my team to just see, we needed arterial blood gases. Guess what? They gave us the results.
That's some good news, but quickly now.
So that person, Federal Jabi saved her. And,
finally, sorry I'm cutting, I'm jumping in because there's no time. Let's see if we can do this in about 40 seconds. The good news about nursing or nurses.
No, the good news about nurses now, that by this academic session, we're going to be enrolling about 67,000 nurses. I just met with the registrar of the Nursing and Midwifery Council this morning. We've put more plans, we put plans in place how we can get more capacity. So I'm happy to report by end of next year, we'll be enrolling over 100,000 nurses in a nursing school.
And you're not training them to go out?
We're not training
you ensure that the salary will be good?
Of course.
Condition of living?
The condition of living, salary will be good. The president has promised us that and is very determined. The president doesn't make fake promises. Whatever he says, he fulfills its commitment.
Well, promises are not meant to be broken. Dr. Alausa, I'd like to thank you for your time, and I do hope we'll have this conversation again sometime soon.
Thank you, Suleiman, anytime.